young people are almost immune to this disease. The younger, the better. I guess they're stronger. They're stronger. They have a stronger immune system. It's an incredible thing. Nobody's ever seen this before. Various types of flu will hurt young people more than older people. But young people are almost immune. If you look at the percentage, it's a tiny percent of 1%. It's a tiny percent of 1%. So we have to have our schools open. We have to protect our teachers. We have to protect our elderly. But we do have to have our schools open. We have very little problem in this country at this moment, 5. When you have 15 people, and the 15 within a couple of days is going to be down to close to 0. And I just see right now it's about 149 cases. We pretty much shut it down, coming in from China. It will go away, just stay calm. I am officially declaring a national emergency. We have a problem that a month ago nobody ever thought about. A lot of people think that goes away in April, but they think August, could be July, could be longer than that. Now we're working very strongly with China on the coronavirus. That's a new thing that a lot of people are talking about. Hopefully.
One of the scariest things about being in infectious diseases is that every few years something pops out and you go, oh my God, how did we not know about that? So, HIV popped out in the early 1980s. Where was that before, right? SARS, monkeypox. We have this Middle East coronavirus now that's killing 50% of people it infects. And it just popped up in the last year or two. That's one entirely feasible doomsday scenario that a lot of people are really worried about happening.
There will be a surprise outbreak. Given, as you heard from the introduction, that I have been around for a while and have had the opportunity and the privilege and the pleasure of serving in 5 administrations, I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak. And I hope by the end of my relatively short presentation, you will understand why history, the history of the last 32 years that I've been the director of NIAID, will tell the next administration that there's no doubt in anyone's mind that they will be faced with the challenges that their predecessors were faced with. So for those who think that infectious diseases is gone, there's so many people who have made foolhardy statements not knowing at the time that they made them. I usually show a quote from an old Surgeon General or an old pundit in infectious disease. So I thought I'd pull this one out from Sir Macfarlane Burnet, who was actually a Nobel Prize-winning immunologist, who made the statement, as many did, to write about infectious diseases is almost to write of something that has passed into history. The most likely forecast about the future of infectious diseases is that it will be very dull, which is really kind of interesting coming from a semi-genius like Macfarlane Burnet. And I think what he did, and the mistake that so many people have made, is something that several of our panelists have already referred to. And that is a failure to look beyond our own borders in the issue of the globality of health issues, not only things that are there that will come here, but surprises that we have. What are the lessons that we learned from HIV? One, you have to commit substantial financial and human resources. These things don't get addressed spontaneously by themselves. You have to enlist the best and the brightest investigators in both basic and clinical research. You have to involve the community, be it the gay community in the United States or the community in Africa and West Africa when we dealt with Ebola, or the people in South America when we're dealing with Zika. You have to have cross-sector collaboration. You can't do it alone. The CDC can't do it alone. The NIH can't do it alone. You do it with all of us, with industry, with global organizations, with philanthropy and NGOs. And you got to get the leaders and the policymakers involved. What is for sure that no matter what, history has told us definitively that it will happen because infectious diseases, as I said 8 years ago in this article with David Morins and Greg Folkers, that it is a perpetual challenge. It is not going to go away. So the thing we're extraordinarily confident about is that we are going to see this in the next few years. Thank you.
It won't be as bad as some people think it could be, but we're working very closely with them and with a lot of other people in a lot of other countries, and we think we have it very well under control. We have very little problem in this country at this moment, 5. The virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically that will go away in April. We're in great shape, though. We have 12 cases, 11 cases. And 61% of the voters approve of Trump's handling of the coronavirus. And, we did a very early move on that. I was criticized by a lot of people at the beginning because we were the first. We'd never done it before. We closed our borders to certain areas. It's never happened before. And we very much closed our doors in certain areas and about certain areas, through certain areas, and we'll see what happens. But we have the greatest doctors in the world. We have it very much under control. We accepted a few people, a small number of people. They're very well confined, and they should be getting better fairly soon. Very interestingly, we've had no deaths. The flu in our country kills from 25,000 people to 69,000 people a year. That was shocking to me. And so far, if you look at what we have with the 15 people, and they're recovering, one is pretty sick, but hopefully will recover. And again, when you have 15 people, and the 15 within a couple of days is going to be down to close to 0, that's a pretty good job we've done. We have a situation with the virus. We've done a great job. And the press won't give us credit for it. We have, in a world that has some big problems, you look at China and you look at industry between the two countries, and I did something that had never been done before, because it had never been done before. I closed our borders to certain areas of the world. I won't be specific because it's not nice to be, specific, but you understand where. And I closed the borders to certain areas of the world very early. We'd never closed the border before. We've never done that before.
Right.
And flights coming in and people coming in because they had a very early problem, and I closed them. I took a lot of heat from the Democrats. They said, what's he doing? Because anything I do, they'll do the opposite. Some countries are doing well, some countries are not doing well. You can see that for yourself. And a lot of things are happening. We're very well organized. We have great talent, great doctors, great everyone. There's tremendous spirit. Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. They're politicizing it. We will do everything in our power to keep the infection and those carrying the infection from entering our country. We have no choice. Whether it's the virus that we're talking about or many other public health threats, the Democrat policy of open borders is a direct threat to the health and well-being of all Americans. Now, you see it with the coronavirus. You see it. On Monday, I'll be meeting with the largest pharmaceutical companies in the world, actually. They'll be coming to the White House, and we're talking about a vaccine and developing very quickly, and they've already started working on it, developing very rapidly a vaccine for the virus, to combat the virus. And we're having very good initial feedback. And I'd like to just ask and caution that the media, we would respectfully ask the media and politicians and everybody else involved not do anything to incite a panic, because